Thanks so much for joining us at 9. I'm Mark McPherson. Verona Area High School is getting ready for an all-school program aimed at preventing fentanyl deaths among teens. It's part of a growing national effort to teach students and families how to recognize the dangers of counterfeit pills and how to save a life. WMTV's Shayna Najawan joins us live in studio with how the district is taking this project on. Shayna.
Mark, before every student sits through Thursday's program, the high school invited families to come hear the same life-saving information. Tonight, I talked with the organization Song for Charlie and school leaders about why this kind of awareness cannot wait.
This is a really unprecedented public health crisis. While overdose deaths are going down, it's because of education, and it's because these are preventable.
That urgency is behind the program Verona students will attend Thursday, mirrored by a community event the night before.
And so that's what happened to Charlie. That's what happened to my brother Dylan. So my family's from Madison, Wisconsin. My brother went to La Follette High School, class of 2011, and Dylan was only 26, and he was struggling with his mental health, and he purchased online a pill he thought was a Xanax, and it contained a lethal dose of fentanyl.
Leaders with organization Song for Charlie say stories like Dylan's and Charlie's are exactly why education saves lives.
83% of our youth, once they have awareness about fake pills and fentanyl being in them, have less use, 83%. So that is why we're doing this program. That's why I believe in it so strongly, and I love the partnership with our community providers and Song for Charlie.
Verona Area High School says protecting its nearly 1,800 students guides everything they do.
That's why this matters so much, and we will do everything we can to prevent anything and be proactive.
A key part of that support is harm reduction. The district brought community partners directly to families Wednesday, with tables offering naloxone training, mental health services, and connections to local providers.
And if we had the harm reduction tools such as naloxone or how to recognize and respond to an overdose, if we knew those things, he could still be alive.
And the message is clear: no family is exempt from this risk.
So there's just this general perception that this won't happen in my school, to my family, and my community, and that's just not true. We've seen this touch everyone. It doesn't matter your socioeconomic status, your background, your language. This is something that we need to understand.
And tomorrow's program will bring all 1,786 students through the presentation in 2 large groups. Tonight's community event gave families the chance to hear it first, ask questions, and meet local resource providers. Live in the studio, Shayna Najawan, WMTV 15 News.
All right, Shayna, thank you. Experts say overdose deaths are declining across the country, but only because of education and preventative measures.